Hello, everyone. My name is Zaiyanatu Abubakar Umar. I'm a technical assistant to the Coordinating Minister of Health and Social Welfare. I also lead the HRH component of the SWAP Coordinating Office, and part of my schedule is the focal point for the Collaborative Action Strategy in Nigeria. And so we're delving into why CAS, the strategic blueprint that was part of the Renewed Hope agenda of President Bola Tinubu, has redesigned a framework that focuses on effective, equitable, and quality health systems, as well as health security and effective governance, amongst others. And top burner for this is in terms of delivering health to improve the lives of the citizens of Nigeria, reducing physical and financial pain, and ensuring quality health for all through accountability, ensuring the quality of services reach where they reach to the points where they need to be. And Nigeria committed to the CAS as in terms of alignment with this strategy because there's already political commitment through this decision makers at all levels, prioritizing fewer and more efficient campaigns with efficient use of resources. In terms of institutional knowledge, there's extensive history of the integration efforts that provide a strong foundation for leveraging the CAS. And then there's the near-term momentum in terms of intra and interdepartmental norms that are evolving from the SWAP adoption and, of course, the NPHCDA's 2024 internal campaign coordination initiatives. We are talking about the lack of communication, the need for better synergy between the Federal Ministry of Health and NPHCDA that are in the front burner when it comes to campaigns in Nigeria. A lot of the times we have been working in silos. Collaboration and disincentivization in terms of siloed structures and inconsistent per diem practices that leave some of the programs at the mercy of others. And of course, there's the bandwidth for constraints with the health systems that have been overburdened in terms of the health workers always being on the field rather than attending to their primary responsibilities at the healthcare centers. So how has CAS been adopted in Nigeria? Following the launch that was in January 2024, there have been major strides, which include the development of a collaborative action strategy guideline that serves the domestic needs of Nigeria. We looked at the guideline and we were able to develop it to suit the needs in country. This was following the inauguration of a technical working group that is being co-chaired by the NPHCDA and the Director of Public Health to bring about the synergy that is much needed between the Federal Ministry of Health and the National Primary Healthcare Development Agency, which are the top burners, like I mentioned, in terms of campaigns. The TWG has subgroups in terms of planning and implementation, Merla M&E, and financing. And towards the end of last year, we were able to build implementation plan for the NCAS, including detailed implementation tasks with roles and responsibilities for persons, timelines, and costs also being established. The campaign integration opportunities were also mapped using a specific matrix, and we closed up the year with plans for 2025 to actually begin implementation. So 2024 was more of a year of planning and sensitization and kind of engaging on the CAS. By 2025, we would begin the real work in terms of CAS. There have been major lessons learned, especially with Nigeria as the pilot country for the collaborative action strategy. We've literally been building the boat as we go, but we can say for sure that there have been the establishment of clear focal points in the Ministry of Health and the NPHCDA has been a key factor for success in terms of coordination and implementation. The establishment of the heads of the agency and the head of the Federal Ministry of Health that is relevant to this, that is the Director of Public Health and the NPHCDA co-chairing this this strategy has been crucial in terms of sustaining a political will. And the fact that we kicked off with in-person workshops and facilitations was an effective means of socialization at the different levels. We also established a readiness assessment that created the baseline for what is actually on ground so that we know where we're taking off from and what we can use to measure in terms of tracking the progress and where we need to sit back and realign. What are the key changes that have been established since the CAS implementation? So CAS principles are starting to be embedded in upcoming campaigns. This is something we're very, very happy about. At every stage for each of the disease programs, there is mention of CAS. There was a meeting earlier this year where the NPHCDA was trying to actually study the health campaign effectiveness in terms of the NPHCDA space with the polio and non-polio SIAs to improve on the campaign opportunities and to also see through what areas they could further collaborate with the disease programs from the Ministry of Health side of things. Then collaboration and integration has become a growing priority with the NTDs actually launching the NTD Day with the mention of the CAS as the next way to go in terms of campaigns for NTDs and malaria, hopefully. So I'll hand over to my colleague, Mr. Shehu Hassan from the NPHCDA to take on the next couple of slides. Thank you.
Okay, thank you, Zaya. Yes, my name is Hassan Shehu Usman. I work with NPHCDA, that is the National Primary Care Development Agency. I am the head of non-polio SIA and also a focal point for the HCE, that's the CAS. So I work in collaboration with the Federal Ministry of Health and the CAS, the focal point there. Yes, last year was kind of planning for the CAS implementation, while this year is for the real implementation. So these are the anticipated 2025 CAS timeline in Nigeria. For the first quarter is the formalization of NCAS. That is NCAS formally launched and national coordination body established. Then also to pilot campaign for integration identify, the financing and policy solution for integrated health campaign prioritize. So in quarter two, we are looking at the tool harmonization, that is a coordinated MALA framework and funding strategy formalized, and also common tools harmonized. For quarter three, we are looking at the initiation, that is the state level coordinating body established, the CAS-led integrated campaign conducted, and also finance harmonization framework formally agreed upon. While in quarter four, we are looking at the acceleration, that is CAS practices integrated into a campaign, the campaign selected for transition into the PHC system. So in 2026, we start the monitoring and scale up, that is the regular campaign report published, and also CAS practice assess and also refine. So as said by my colleagues, the team have been able to map all the campaign for 2025 in country, and also working with together to also identify which campaign can be implemented together. In the Federal Ministry of Health, that will be through the MOH integration meeting in March this year. So these are the campaign that we conducted in 2025. In January, we have the World NTD Day, while in February, there's going to be MOH campaign alignment. For February, as the NPHCDA, as an agency, called for a dissolution meeting where all partners, the donors, the Federal Ministry of Health, all involved in a campaign ecosystem were invited. So the workshop focused on the immunization campaign, that is the polio and non-polio campaign. And what we look at the workshop, the objective is to identify some issues or challenges and how solution can be provided for us to have a more effective campaign. And about 6 of these were identified, ranging from the team selection, supervision, localization of ACSM, single database, and also integrating the polio and non-polio, which you can see they are all embedded in the CAS recommendation. So in March, we are having malaria campaign, that is a micro planning. In April, there will be polio, that is vaccine week, there will be polio campaign and also ITN malaria campaign. While in May, we are going to have the LF campaign, the malaria SMC campaign, integrated immunization campaign, and also the first round of polio campaign. So in July, June is a mark for MSH week, while in July there will be malaria campaign. In September, there will be polio campaign and also malaria campaign. So in October, that is the when we plan to integrate the non-polio campaign and polio, because we have the measles rubella catch-up campaign this year, and also we are going to have a round of polio campaign in October. So already we've started working together right from planning. We're planning together to see that this campaign are integrated right from planning up to the post-implementation stage. So in November, there will be MNCH week, and also integrated immunization campaign. So this is what we have for this year. For the NTD campaign, they are not included now at the timeline because the date has not been finalized. But we are able to realize that for long-term CAS success, it will require budget, people, and voice. So we're looking forward for all the donor and partners for support so that we can achieve the objective of CAS.